live streaming is on.
Hi, Ralph.
Almost time. All right. Are we missing anybody?
Let's see.
Yeah, I don't think Elaine is here.
Okay.
That I can see. And is Keith, are you on? I see a K.
Yes,
Theoretically, he's on.
yes, I'm here.
Okay. 1, 2, 3, 4, 5. We're missing Elaine and Brian Brundage is not here.
Okay.
And then I think Eileen O'Connor will tune in a minute. We expect.
Good morning, everyone.
We do have a quorum, though, Dr. Kosachev.
Excellent. Okay, so we'll start with, thank you for participating, and we'll start with the approval of the minutes. If anybody would like to make a motion.
I so move.
I will
Anybody?
second.
I'm sorry, does anybody have any questions or any issues at all with the prior minutes, by the way? No? Okay. Very good. Thank you for the motion and for the second. Okay, why don't we move to approval of claims? Janine?
Okay, sorry, I was muted and I couldn't get my mic off there. All right. On the warrant of 5520, we paid University Hospital for some rabies treatment for $1,598.97. We also paid a Joshua Avery $350, which was disinfect a quarantined apartment that we've been using for quarantine. We paid Brian Glaska $5,215 for the septic replacement program. We also paid Little Luke's special programs for tuition retro rates that went back to 17-18 and 19-20 school year. They were $56.92, $1,393.19, and $1,080. And under the WIC program, we paid Kevin Cartwright $80 for snow plowing this winter, which was part of the rent agreement. With the credit card payments, the WIC Association of New York refunded us $720 for a conference that was going to happen in Niagara Falls for the WIC staff. And due to COVID-19, they have canceled that conference. So they refunded us the registration fees, $720. We also purchased 2 breast pumps from Medela for $709 through the WIC grant. And I do believe that's all that I have. Does anyone have any questions on the claims?
Is the price of the breast pumps unusual? Or is that fairly typical?
That was for 2 breast pumps. They're like $300 each.
Okay, thank you.
I will verify that cost.
Thank you.
Does anybody want to make a motion to approve the claims?
I will motion.
This is Ralph, I'll second.
Thank you.
A good initiative.
Anything else for us, Janine?
No, I have nothing else.
Thank you very much, Janine.
You're welcome.
Is Eileen on yet?
Yes, I'm on.
Hi, Eileen. How are you?
Good. How about yourself?
Good, thanks. Looks like you're on.
Okay. I'm trying to turn my camera on, but I can't. So anyway, I guess there I am. Hey. Okay, so one of the things on the agenda is in the news that Wells College may close before the end of the school year. Or, I mean, before the beginning of the school year. And Wells College provides water to the village of Aurora. So I had a talk with the mayor, and she wondered if the county would be taking over the water system and providing water to the village. And I said, no, we wouldn't be doing that. But I did ask her to talk with her engineers and put together a plan on what they are going to do. You know, are they going to take, if it does happen, and I don't know, you know, how likely it is. I'm thinking it must be pretty likely for the Wells College to say that to the newspaper. So I asked the Village of Aurora to get me a plan by the middle of June on what's going to happen. Are they going to take over the plant, or what? Or is Wells College going to continue to provide them water? Are they going to have a minimal staff at the college to maintain the buildings and everything? So I will learn more to come, but I just wanted to make sure the Board of Health was aware of this issue. Any questions? And maybe Keith,
Yeah.
Keith Bass, you might know information on this that I don't, about the likelihood of the college and the Village of Aurora.
Yeah, it's and I'm wondering, has anyone, because I haven't, I didn't think it was my place to do it directly, but I've made informal reach outs with the Water and Sewer Authority, because chances are that's what the mayor was talking about. I think most people don't appreciate that the Cayuga County Water and Sewer Authority is not Cayuga County. And I know that there's at least a possibility that something can be negotiated with them. Have we had any conversations with them at all?
I have not. You know, I thought I would let Aurora make the first step because, of course,
Okay.
Water and Sewer Authority, they don't step in until they're requested to do that.
Yes,
You know, so
yes.
if Aurora can take it over on their own, then that would probably be the solution.
Well, I'll talk to Bonnie about that. In terms of the college closing, I mean, it is a critical time for them. I do not think that the process of, even if they do close their doors, go out of business, I do not think it's something that will be done quite that quickly. They may not have students, they may not open for classes, but to close a college is a significantly involved process. So I think in the short run, the college will almost have to continue to do the water unless they can find someone to take it over. But it is one of the things up in the air. They have sent out a request to alums for, I think, to try to raise $4.3 million in the next few weeks. And apparently the response to that has been pretty good. So at this point, all is not lost, but it doesn't look good. So that's, I think, about as much as I know.
Okay, thank you.
This is Nancy. We just had a outreach from the clinic there. The physician down there wanting to, as the medical director for the college, wanting some assistance from us for the next school year. So that just came today. Just an interesting point that at least they're planning on next fall.
Okay. I just wanted, to make sure that you guys were aware of this issue that may be a difficult issue in terms of the water supply. The other thing on my agenda, I was just going to be talking about some of the issues that have come up that our office has been dealing with regarding COVID and public events. So we have spent a lot of time talking with various groups. One is different school groups. Schools and parents want to do something for the graduates. They want to hold different events. And we've had to tell them at the current time, social gatherings are not allowed. Golf, I've spent more time talking about golf. I'm not a golfer, so I don't understand the need to golf so much, but I have talked to so many people because there was conflicting information from the state regarding golf courses. Could they be open? Were they not allowed to be open? Now, though, they are allowed to be open as long as they are doing, social distancing and disinfection. So they are allowed to be open under the current directives. Walmart, we received a lot of complaints from Walmart and some from other stores like Home Depot regarding not wearing face coverings, the customers, and also those that weren't wearing face coverings, they were not social distancing within the store. So we had many conversations with Walmart, with their management, with their regional management to try to get some more compliance on those issues. And we haven't received a complaint in about a week. So I'm thinking things are better. And also somebody was there recently and said they saw most people wearing face coverings. We've been talking to Airbnbs where they want to rent to large groups. So they've been calling to inquire. Restaurants, we've been receiving a lot of complaints that when people are there to pick up their takeout or like an ice cream stand, that people aren't social distancing, or that some of the restaurants have set up like picnic tables outside of their area so they can pick up their food and then eat at the picnic table. So we've had to call and tell them, no, they're not allowed to do that. Church services, we've been getting some calls on, if they can provide different types of church services. Veterinary services, which are allowed. We've received a couple calls because some of the vets just don't want to be open right now and upset by that. So I just wanted to kind of bring to your attention just some of the stuff that we are dealing with that is not really like, of course, Nancy is spending so much time on the clinical side, but there's the whole social side too that our office has to deal with. Any questions? Okay, that's all I have then.
Thank you, Eileen.
Are you hearing me, everybody? It's Brian.
Yeah. Who's that?
Brian.
Hey, Brian.
I'm here, but I'm not visible. I couldn't get my laptop to work this time. I don't know how I got it to work last time, but it did last time, but I couldn't this time. But I'm just wondering, Eileen, what's the legality of this stuff with the enforcement? I got a question from a friend that wants to be involved with the group garage sale on Lake Avenue, and she's afraid that they're going to get shut down or something. What's the legal standpoint of the health department on that kind of stuff? Do they have the legal right to shut down a public gathering like a yard sale on private property?
Well, I think, and Kathleen probably can answer this probably better than me, but I'll give it a shot, that it's a governor's directive and that's enforceable by law enforcement. So law enforcement could actually go and shut them down. What our approach has been is we are trying to educate these different groups. So, we're trying to, when we get complaints, we don't just send it to law enforcement because of course law enforcement would probably go crazy with them all. So we try to talk to them and educate them and to get them to comply. But it would be a law enforcement thing that they could go and shut down an event like that.
I see. Okay. How about summer camps? Has there been a decision reached on summer camps, like the Camp Ayahuasca, that kind of stuff?
There has not been a decision reached. I know that it's a big concern statewide because daycare or, summer camps are quite often used as daycare. And as people are going back to work, they're going to need this daycare. So I know the governor's office is interested in, having summer camps open, but how to do that safely is another question. So they haven't given us guidance yet on opening summer camps. We're moving forward like they would be open because it's a ton of work up front. We have to review safety plans and, there's just a lot of upfront work, and we don't want to be caught at the last minute having to quickly open them up. But right now we don't know what's happening with summer camps.
Okay,
Eileen?
thank you. Thank you.
Eileen, when would they open if they were normally going to open?
The earliest ones are the Y and Casawasco, and they typically open right after school gets out. So the last week in June. Other camps typically open after the 4th of July. So, we'll see.
Okay, thank you.
If I could add a little bit more information on the garage sale side, that was a topic of conversation on a community leadership call, and there was a discrepancy of opinion with some of the people on the call. So we're going to get on board with the same message. But as part of that, we have asked Aileen, and she has sent forward to the Regional Economic Development Group, the counties involved, and because we want to have consistent enforcement across our respective counties when it comes to not only what places are doing, but the interpretation of the governor's directives. So not only is she getting clarity about that, she's asking the opinion of the other counties because Lake Ave is a huge one. Route 90 is a huge one. People have been cleaning their houses and they want to have sales, but how do you invite strangers into your home, even though it's, for a public venue, you make it public when you allow people to come to your sale. So we'll get a little bit more information on that, and then we'll probably have to make some public statements.
Mm-hmm.
Eileen, I just looked up Casawasco has closed for the summer.
Okay. Thank you.
One less thing you got to do.
Yes. And hopefully they won't say they're going to reopen later. Well, if they do, we'll just have to deal with it. But I didn't realize that they had already made that decision.
Yeah, I was told by a patient, I just looked up, it's posted on their website that they're suspending all summer programs for 2020.
Yikes.
Very good. Any other questions for Eileen or comments? Okay. Shall we move on to Kathleen on a more official level?
Well, I know that Nancy will talk a lot about the clinical work that we're doing and kind of reflect on some of the cases that we're seeing and a little bit about the context of some of them. Sorry, so click in on here. We are going through the process. There's been a lot of changes over the last couple weeks and a lot of information that's come to us through New York State and through the State Department of Health. And I think I may have used this analogy before, and some of you have heard me say it. We've got, the governor's office on a parallel track with the State Department of Health. Sometimes they don't, they're not in communication as readily with each other as far as implementing things. And then it's kind of a hurry up locals and perform it. And that had been a little bit frustrating. I had one area of concern. We have a new phone system. We're learning how to work with this. and it beeps on our screens when this is happening. Sorry about that. So anyways, one thing we had received via Homeland Security sent to our emergency management office a lot of specimen collection vials, which is great. We're glad to have it. They sent them to all the health departments apparently. So we don't know if it came from State Department of Health. We're not quite sure. But when we received them, some of the information was not in the boxes that we had. So it took us a day or two. We found out what the medium is to make sure that the lab we use can make use of it. But we also didn't know when these specimen collection bottles were going to expire. And one of our staff saw a sticker on the box that said not till 2021. We thought, oh, that's marvelous. So I scanned that and sent it to Wadsworth just to verify. And I'm glad that I did, because the chemist at Wadsworth said, oh no, that's only if you kept these refrigerated, and that hasn't been done. So they expire 3 weeks from their pull date. That's fine, but we don't know what the pull date is. So that's been a real frustration. Some of the things that shouldn't be complicated, one would think, become quite a process. But in the interim, we are using them because we know when we received them. And so even if we had received them within a week's time, we can feel pretty confident that we're within this 3 week span, at least through this week. Nancy will speak to some of the clinics and what we've been doing there. The other big change that we're seeing across the state right now is a move to a consistent contracted process for contact tracing. Now, there's some options, and we're learning more all the time as local health departments. Local health departments do contact tracing all the time. And most of us want to be able to continue doing that as long as we have the capacity to do so. Right? But we certainly also want to be prepared in the event things really, explode and we have a need for use of additional resources. So within our region, the Central New York region, Onondaga County and Oswego, we're getting trained yesterday and today. They're supposed to try going live. And Cayuga County will be trained this afternoon. There's a training. I believe tomorrow there's a training, and we're supposed to try to go live perhaps on Thursday. And we'll know more as we do this. So it's a number of our staff are taking this training. And I think we'll have some of our questions answered about how we engage with outside contractors if necessary. That's not perfectly spelled out yet, but it has been incredibly helpful for us to have some routine calls with our NICEHO group and routine calls with the State Department of Health, because the questions I have are not unique to Cayuga County. That, all the other counties have them. It's really an interesting perspective because the downstate large counties are anxious to start the contact tracing because that has been an area of need, but also because their number of diagnosed people just exploded so quickly, and so many. There was, they were reliant upon people to get a diagnosis and, isolate and quarantine and on your honor type thing. And so the contact tracing was taking an exceptional amount of time and probably could not happen as quickly as they desired at times. So it'll be neat to see how this unfolds and how it will be sustained over the forthcoming weeks. There's probably some other stuff I could talk to you about, but maybe once Nancy speaks, and you might have some more questions. And
Kathleen, could you explain when you said you'll be able to go live? Because you've been doing contact tracing all along. I don't know what you're referring to about after the training going live.
It's a brand new computer system. So what we needed to do as a local health department, we created our own process, which is what every health department had to do in order to identify, track, trace.
Right.
Sorry, Mary
go
Elaine.
live in the state system?
The new state system. It's
Yes,
called
okay.
ComCare.
Yes.
And it's not an option. Every health department must join it. So even though we created and we have our own process, that's great. You still have to join ComCare. And that is hopefully going to provide a level of interoperability across New York State. We have so many daily reports that we are being asked to send statistics and information to the state. Hopefully, this will help provide a greater level of efficiency in that regard as well.
But the people who are utilizing the system are the same. It's not as though somebody from Poughkeepsie is going to be doing contact tracing for Cayuga County.
Well, that is exactly what we're wondering. Right now, it will be the Cayuga County Health Department staff who will perform it. If we reach a point where we need assistance, there were over 31,000 applicants to become contact tracers across New York State, certainly many of them in central New York area. So this is some of the information we need to learn more. How will that happen? If we say, I guess we've reached our limit, we need to focus on, what we do and ask for some assistance in contact tracing. We don't know yet because we don't know what our limit's going to be yet. Everybody's been able to and willing to, work longer when necessary. And it's really been a huge benefit in many ways to be able to provide consistency, not only with the contact tracing, but a lot of times you're the same person who might call them for their quarantine call or follow up to get them the resources they need because they can't get out to the grocery store or whatever their circumstances happen to be. It's been great case management, not just contact tracing, but we'll see.
Anything else for us, Kathleen?
Not right now.
Does Nancy feel like she wants to talk to us now?
I think so.
All right, Nancy, whenever you're ready.
You're on mute, Nancy. I'm watching her icon. It's still on mute. Wait, so while
Nancy, can you hear us? You're still on mute.
us, but she's trying to get her microphone undone. I can tell what
Okay.
she's working on here.
Okay.
And this is,
Are we there? Yes.
Yes.
Hello, everybody. Unfortunate for you, you missed the best part. I've already said the best part. But anyways, I'll carry on. I'm going to pick up where Kathleen left off. Pretty impressive, I think, what was developed here by a nurse for our intake of patients and our daily calls, and also the nurse's notes and so forth. So we were able to do that by starting with documents that I created, and then we uploaded that, and we've had a system in which we've been able to really for everyone to use in the department, the nurses, and it's been very helpful. Obviously, it's homegrown, so it's not, we have great hopes for what the state has come up with, but we are definitely going to go through a period of bridging those two. And we're going to just have to assess and evaluate. My intent is that we'll start with a core group, the core group that's been doing this, and we will work within the new system until we've got some expertise and some efficiency. And then we will determine if there's any other tools that we may need to create, enabling us to give the care that we've given in a personalized manner. I think right now it is extremely important if we can do this ourselves, because there's so much new learning for not only us, but for our community members. And we're talking mostly behavior change. So going back to what Eileen was saying and the challenges with businesses and places, this is all behavior change, very difficult very challenging for every individual. So hopefully what we've tried to do is personalize that more, have an understanding of the challenge. And during our personal engagement with these folks, we get some trust and we get compliance. That's what we're trying to go for, to minimize the effects. So we will see. We will be on to something new this week. We have done for the clinics, as you're well aware, we have opened up to essential workers. And thus far, the testing that the health department alone has done is 42% of all testing done within the county. And then if you add on to that 42%, and I don't have a number, but the number of testing, swabbing that's been done at the respiratory clinic, we're probably near 50% that has been done in those two spots. So that is good. I would say with doing the essential workers, and you've noticed in the paper that there's been an increased number of cases that is associated to the increased amount of testing. I just want to make a note here that we haven't had in the health department clinic yet today, as of this hour, one positive case out of that clinic. We also, as of today, this hour, have not had a positive case out of a nursing home employee or patients within this county that have been tested by New York State. New York State has sent troops into different nursing homes and has been testing. Fortunately, we've been crossing our fingers that those tests have come back negative. Of course, there's a whole different topic in whether we think we can rely 100% on the test, right? But as we go down this path of learning, what I'm hoping that at least the increase of testing, what it's hopefully will have done is that people get more accustomed to it and not view it as a scarlet letter if they have, or if they're associated with a positive. As you all know, places, businesses that had a positive case were chastised for having that case, and that has not been easy for anyone. And so there was really no nursing home wanted to be associated with a positive case. And so maybe this will help soothe some of that. The cases that we've seen in the increase are, kind of spread, from spread. Onondaga has had a lot of cases. Well, we have healthcare workers that live here that work in Onondaga County, and that's where those cases are. Essential workers are the number one that have contract this, and then they go home, and whoever they're communal living with is where we see the next bunch of cases. We actually have a couple families that we've had in quarantine, some faction of their family over a month. If you can imagine the trying times for families such as that, because one gets it, the next one gets it, it elongates the quarantine for the one that hasn't got it. It's just it's a big family affair that we as a team have tried to help provide a lot of emotional as well as guidance for physical care when they need it. And it's been very helpful to have the clinic or to have the respiratory clinic, because we can get people seen sooner. When we see them going on over that slope of not improving, we can get them care before they get worse. What else? I'm interested in what, and back to the businesses and so forth. It's certainly not perfect by any means, but we've been trying to have conversation. I've been out to businesses, I've been out, and so has other team members, and just trying to talk to groups and and help them understand. And I think we've been able to get response that has been good. I think that's what they tell me. I'm interested in what any of you have to offer for what you're hearing. We know there's just distress. People are annoyed with some of the things. Do you have any feedback for me and Kathleen in the group?
Yeah, Nancy, this is Keith. I have a question,
Yes.
if I may. Can you hear me? So,
Yes.
do you? I'm sure you're aware of the issue with the testing of staff in nursing homes and adult care facilities.
Yeah.
Do you know what's being done with that? Because it's going to result in if those requirements remain, it will result in the closing of facilities in Cayuga County, which we really, quite frankly, don't have excess capacity. We can't afford it. So, any plans, any ideas?
Well, I'm interested in what Kathleen says here too, but I just can't even imagine that it could be sustained for any period of time. I agree with you. I know some of the adult homes, they don't have nursing staff and medical staff and that. They are using our drive-through and that's fine. I just, no, there's no plan. I just can't imagine it could be sustained for any great length of time. Besides the fact, what I've talked to the nursing home leaders about, and when they were trying to scurry getting their plan together to go down, to Albany, yes, state that yes, you'll do if available, if possible. And, that's the wording I would have suggested. Also conveying to the state, this is going to be very difficult. But secondly, when you get the plan done, the emphasis has to be in these nursing homes. You have, when you're talking about a substantial number of their employees can be socially, economically disadvantaged also. And so it's education and then it's helping them adapt to things at home so they don't bring it in and they don't take it out of the nursing home. So there's that whole piece. And I had a couple that told me, I'm talking to them all the time. I said, keep talking to them because this is a challenge. And people that are at a social economic disadvantage, it's even more of a challenge. So I don't think that's a full answer, Keith. I understand. We're going to have to wait to see how this rolls.
I'll add a little
Kathleen,
bit
do you have any thoughts
to that? For those of you who are not aware, the requirement had come from the governor's office to have all regulated facilities, adult homes and skilled nursing facilities, test their employees twice a week. This would be an example of that parallel track that I'm describe. It's theoretically a great thing. We certainly understand the reason behind it, but the level of detail wasn't there to provide the support to implement this initially. So understandably, all of these sites, I don't believe there is one single facility who can financially support this. First, it was accessing resources because health departments and private entities are making use of the viral specimen collection kits, and they're hard to come by. Then there is the cost of the lab analysis, which depending on your insurance, first, if you have insurance, second, depending how often will your insurance cover that cost, and then third, if not, it's your employer's cost. They can write a plan, they can write a process, they can find somebody who can learn to collect the specimen, but it's not, the adult homes don't often have nurses on staff. So a flurry of conversations, certainly amongst the facilities themselves and the state, amongst facilities and health departments to see what help we could potentially provide, which it was very clear to all of us, none of us as health departments can be their source to meet this requirement. We're limited on our resources to a certain extent. As Nancy said, we're certainly glad when we have the clinics. If they want to sign their staff up to be tested at our clinics like anyone else, by all means, it's open to all essential workers. But we couldn't guarantee that we could help provide twice a week. On one of our calls, we know that there's been quite a lot of conversation at the high up state level. We understand that there will be some specimen collection kits sent to nursing facilities and adult homes. We know that there's been some education created to have non-clinical people trained on how to collect the specimens. We know that there have been a lot of conversations with laboratories. What I don't think is clear is how the cost will be covered. What I don't think is clear yet is how insurance will pay or not pay. That's the last I heard. We don't know if there'll be a way to sustain the specimen collections. So it's a frustration that the facilities we know in Cayuga County are doing their best to attain that. But boy, it was a pretty steep requirement that was put on these facilities, because not only was it a day-and-a-half turnaround to write your plan as to how you're going to test all your staff, all 3 shifts, twice a week, but also the administrator had to attest, and it's a $2,000 a day fine if you weren't in compliance, and potential revocation of their license. So it was pretty scary to a lot of people. So rightfully so, there was a lot of noise, that was shot up the government line, and I don't know that everything's been answered yet, but I have to think that there is a process being moved forward to help address some of these issues.
Right.
Hi, this is Ralph, and I've got a question for Nancy or Eileen, whoever choose to take, or excuse me, whoever chooses to take it. My question concerns the testing that's being offered by WellNow. I saw a story that WellNow is now offering testing for anyone who's been exposed or may have potentially feel that they have the disease, which sounds like the availability of test kits are now pretty generally available. Is that what's happening with the health department also?
Well, what WellNow is advertising is the antibody test, and they are not doing actual swabbing, nasopharyngeal. They're not testing for COVID. They're doing the antibody test. Can you hear me?
I do think they're doing both, Nancy. But they have
the other day they weren't. So this could change. They were doing that the other day. So
They're
interesting.
The antibody, they kind of do a pick and choose thing, and if somebody isn't having symptoms, I believe they just do the antibody test.
Okay.
They said they had 50 a day they could do, because some of these adult homes were trying to make appointments and they were very limited.
Yes.
And they sent to a lab in Boston that was at minimum a 7-day turnaround time.
So how does this impact the overall picture of how we're addressing this issue if a private vendor is now doing antibody tests? Of course, the health department's trying to keep control of what's happening or get a handle on what's going on, with the testing and so forth. So it seems like you got different actors. Maybe somebody's offering an antibody test, which may not be consistent with the approach that the health department might want to take. Is this confusing matters, or is this helping out?
Oh, it's confusing matters as far as I'm concerned. The calls we get from patients that don't understand their results, that they're inconclusive, and then they're recommended to be tested. There is confusion, and when you look at what I think the major reason why people want to get the antibody test that I've talked to is that they just want reassurance they've already had it, even though proof of having it doesn't mean that you're not going to get it again. It's people reaching for answers, reaching for, I know, and that's my take on it.
From a
Yeah.
clinician standpoint, it creates more questions. I've had several patients who have had positive. There's two types of antibodies you have. You have an M antibody, which is supposed to be high when you've been recently exposed and could be consistent with a current infection. And then you have a G antibody. There's been some patients who have tested positive for an M antibody with no testing, no symptoms. When you PCR swab them, they are negative. But again, then the PCR swab isn't 100%. So honestly, all it's doing is creating more questions. And I wouldn't recommend anybody go do it.
Would you say that this warrants a statement from the health department as far to clarify the situation?
Probably not a bad idea. I think there's a lot of confusion. We certainly do not want to call out any one particular business. WellNow is absolutely making a name for themselves across the state and across the nation for this. From my point of view, if anybody qualifies for the PCR testing to see if you have the virus, go to town. Because if you're positive, it's mandated reporting to the health department. And I'd rather see a false positive than a false negative. And, you know, we can work with that, right? The antibody testing was just so erratic. We did send a survey out to all the health care providers within our county, along with the urgent care centers and the pharmacies, to ask if they're providing the viral testing and if they're providing the antibody testing, and if so, what type. And we did get a number of responses. We're putting that together now, but the doctors on this call are certainly better versed at this than I am. The FDA had put some emergency use authorizations on some of the antibody testing, but there's still such a large margin of false results that it's an interesting surveillance tool, but it's not terribly beneficial at the moment, because we don't know what that means. We don't know what any particular result, what that's going to mean for our community, because we don't know if it means you're going to be immune, you know, for all these reasons. I guess I would defer to some of the doctors and their thoughts as to it. I don't want to confuse matters more by attempting to put a statement out, but if you think it merits that, then maybe there should be one.
Maybe not a statement, but a little, you know, you guys are doing educational things every, you know, week or so, maybe at least an educational standpoint about, you know, here's the testings that you can have, here's what we definitely know, here's what we don't know, here's what we need to learn, and that sort of thing.
Good idea.
I just want to ask a question. Do we know if everybody's using the same antibody test right now in the state, or are various antibody tests being used by different entities?
My understanding is it can be a variety, but I have not looked yet at the surveys we got back. We asked them to be returned yesterday. So we'll have a better idea of what's those who are doing it, what they're using.
I don't know the exact assay. I know the hospital is doing some antibody testing. The hospital is only doing an IgG test, not an IgM. So I can tell you, at least between the hospital and WellNow, it is different testing.
Kathleen, the health department would get the results of a positive COVID test. Do you get any communication on the antibody results?
We do. eClairs now has a COVID antibody listing as well. I assume, since we're seeing it on eClairs, that must be mandated. What I haven't seen is the from the Public Health Council. You know how they always say when there's a mandated reportable disease. So COVID-19, they quickly went to town and saying when you do a diagnostic test, that's a mandated reportable disease. I have not seen that statement regarding the antibody testing, so I don't know if that's, and again, maybe doctors, you have seen something. I don't know if that's a mandate.
you're getting it now. You don't know if you're mandated to get it. Is that
Right.
sort of?
So I don't know if we're getting to some of them or if
Uh-huh.
we're getting all of them or only through certain labs. That's been a little bit of an issue at times too, depending where the diagnosis is taking place and how much load there is on the systems of the laboratories. It's taken a little longer sometimes for us as a health department to get results than it should theoretically. And there have been a few times where we know, like Dr. Archer's received some results and it's more than a day later before we see that same result in our eClair system.
When I listened to Nancy's report, it appeared to me, and I just want to make sure if that's correct, you expanded to do testing for people that were asymptomatic through your clinics. Anyone could come if they wanted, essential workers. Did you find that we don't have a huge incident of asymptomatic positives from the tests you've done?
The ones we have performed, we have not. But Nancy, I think you could speak to some of what you've seen most recently.
But we have several that are asymptomatic that were tested elsewhere. So that's interesting. But I'm also interested in, and they're on our docket right now, whether they will break out in symptoms within the period of time that we're watching them, because that could likely occur as well. We might have got them early. There's one case I'm thinking of right now that I believe he went and got tested. What's another interesting fact? Let me retract that statement and say that we have 3 cases right now that were done on pre-op for a procedure, and they came back positive, asymptomatic. Interesting. One of them, when interviewing him for an intake over the weekend, and of course, very disappointed. Oh my God, a lot of emotion around this topic. It's just really difficult for people. Well, he believes the housemate was sick last week. So hopefully we will get the housemate's test back, and that may be the index case, was actually the housemate. And then the person that went for the pre-op that's how contagious it is. So we have 3 of those cases. We do, Eileen, 3 asymptomatic.
Thank you.
Mhm.
Anything else, Nancy?
Only, do any of you have any feedback from what you're hearing in the community? And what can you provide any feedback to us?
I have not heard anything bad in regards to my interactions from patients, which means it must be good because certainly people are happy to tell me bad things. I will say from my personal standpoint, you guys have been amazing and I can't say enough. I can't thank you enough. You guys are always available when I text somebody in a panic at 2 o'clock on a Saturday, and you guys are doing amazing.
Good.
I can only say that I've had positive comments from the community. I do find that I'm getting a lot of people who are asking questions, once their initial reason for being here is dealt with, they start asking questions about the coronavirus, about the testing. They want to know more. They want to understand more. So, I think communication is hugely important. And there's a lot of misconception out there about how bad this disease can be in the community still, despite all the stuff going on in New York State. It's just amazing to me. I'm not sure where people are getting their information from.
I would add to that, Dr. Kosachoff. I think you raise a really good point. And we are anticipating this as soon as we start to phase in, right? You give an inch, you take a mile sometimes. And we will be very concerned if we start to see an uptick in cases, because here it was just phase 1, which theoretically wasn't dramatically different than what the essential workers had been doing anyways. But it was such a nice weekend. And as Eileen had mentioned, the desire to do things for high school graduates, and then you have college graduates, and then you have friends who want to see each other. And it'll be really interesting it's hard, right? It's hard to remind and refresh people. You must continue to be socially distant, wear your face covering, wash your hands, stay home when you're sick cannot be overstated.
It is amazing, and I'll finish with two other cases that were just striking to me. This was the weekend of May 2nd and 3rd. It was a very nice weekend. We had two pockets unassociated with each other of cases that was because one person in that group just couldn't refrain from the social interaction, that we're all craving. And as a result, has had a rippling effect into business, because one was contracted and another, and it just is huge. Just one weekend, two pockets.
This is Ralph again, and everything that's been said so far really speaks to kind of what my point was in the beginning. Excuse me a second. I'm sorry about that. And there's a lot of misinformation out there, and people are trying to sort things out for themselves. And this is a time where I think most people would look at the health department as the source of good information. And anything from the various tests that are out there, what they mean, and anything else that's going on. It's information and facts, or not facts, are being filtered through different lenses, and people are having to sort this out themselves. And it's really confusing, from a layman's point of view. What do I believe? What I don't believe? Do I go and get this test and I'm okay now? All of those questions. I think it would be really valuable for the health department. Maybe just put out a fact sheet, just to say, here, refer back to this if you have any questions.
Okay, we'll put something together, Ralph. I think, hearing all of your comments, you're coming from your perspective and what you're hearing. So there's obviously will be a benefit to do that. So we'll put something together.
I agree.
Thank you.
Mm-hmm.
Well, there's another community perspective that needs to be at least kept in mind. A lot of people are really at the end of their ropes at this point, and that's a movement that's going to gain more traction because businesses are closing and people are going broke. They're putting money backwards into their business, and they're not seeing any end in sight. And then they hear stories about people who have tested positive that didn't have any symptoms. And they start wondering, what the hell are we doing here? And they hear information about how it's no worse than the flu, and how Sweden never did anything and they're all okay, and maybe they even got over it quicker. And they're also wondering when's the end point, and they also feel like they're getting lied to because this was supposed to be a 2-week thing. And now you got people saying, well, forget about your summer, forget about Broadway opening up all summer, forget about your beaches opening up all summer. And that's going to be a significant obstacle. And I think there's got to be a little bit of reality too on the health department and everybody in healthcare, that there is a degree at which point all the social isolation and closing all the businesses is going to hurt people more than the disease. And I think it's really important to focus on the end problem, which is mainly old people and sick people. And I think all the measures that could be put in place for them are very important. But there's got to be a bit of a compromise with other people who are not young, or who are not old, and who are not otherwise ill. And that's going to be a challenge.
Yeah. When I think of our only, fortunately, person that died was 41, was a laborer in what is known to be excellent health. And that took him out. And I know from seeing a couple that I was very concerned about, and they were young, so I know it affects the aged more, but I appreciate your comment because that is what is being said on the community. And I don't know how, the best way to handle that,
No, there's got to be a compromise, I think, because if the powers that be want to curtail this disease completely, then really we shouldn't be allowed to get in a car. Cars should be outlawed because people that are young and healthy die in cars. And I'm not trying to start an argument or get in a fight. I'm just trying to tell you what the question was, what are you hearing in the community?
Yes.
And this is the subject of much conversation amongst me and my peers. If you're going to worry about one young person getting sick and dying at the expense of completely trashing the entire economy and having people literally have their life savings evaporate, a lot of people are going to say, screw it, I'll take the chance. And at some point, it might be reasonable to let them take that chance.
And you know what? I value what you're saying because you're coming from being an emergency physician. So you know that you could be confronted with all this, or you would have been. I know. I don't know I don't know. I just know with every
It's not an easy
for us.
I don't think we're going to come up with an answer, but I'm just putting it out there as the counter to what have you been hearing in the community, and that's definitely a movement that's gaining traction real fast, as you can see when you watch the news and you see lockdown protests and things like that. So I think the thing to do is be real compulsive with the nursing homes, personal care homes, the hospitals, but at some point things have got to relax and get more back to normal because there is no end in sight, and we haven't gotten rid of the common cold, we haven't gotten rid of HIV, we haven't gotten rid of influenza, we haven't gotten rid of zoster or herpes, or viruses. It's a big reach to say that we're going to be able to vaccinate this thing out of existence, and that's the reality check on it. We might have to just wait till we get some herd immunity, and this is where that I get confused when I start hearing these things about people that come in and they're asymptomatic and they can't believe it. They come in, they get a test. What do you mean I'm sick? Maybe it was my roommate. Now I have to stay at home for 2 weeks. I got a mortgage payment. I got no food in my pantry. What the hell am I supposed to do? I don't even feel sick. And I understand the other side. Sure, then that goes to the next person, then the next thing you know, it's in the nursing home and it takes out half the nursing home. I understand all that. But the reality of the community perception is, what the hell are we doing?
Well, and I'll add, Brian, we certainly, as we're phasing in, that's why we've got to keep reiterating the prevention, right? We've got to have some reasonable approaches to get back to what will become our norm. But one of the things that certainly has been brought to our attention, and all of you have probably seen that too, but I would be remiss not to say something, is the concerns of increased severity in chronic health conditions because people have not been getting some of their preventive care. The increase in mental health disease exacerbation, the concerns about increases in substance use and domestic violence, because these are very stressful times. So there's no question that this is something that has to really, we have to move forward and really give consideration to all these facets and find ways to work reasonably for prevention, continue forward with the science aspect of things, and find ways to help our neighbors cope.
Yeah, and trust is a big thing too. That there's a lot of distrust amongst some of the bigger players, like Cuomo, for instance, who has edicted that anybody who dies in New York City, if COVID could have been a factor, then you should chalk it up as COVID. And some of the things I've read, people that have literally fallen down and gotten a subdural, and then they get picked up and they put on the death certificate COVID. They never tested him, but they said, well, he might have been sick and he might have passed out because he was sick from COVID. And that's inflating the numbers, and it almost gives the perception to the public that the whole thing's bullshit. And that's another thing that I've been hearing a lot about in the community, that people are saying, this is absurd. Cuomo first he puts out an edict that says the nursing homes can't refuse a COVID positive, and then 2 weeks later backpedals and says, "Oh my gosh, that was a bad idea," and there's a lot of distrust, and a lot of people are getting sick of watching the same old junk all the time. So I think the take home, the useful take home, that was a rant. The useful take home is that the trust is going to be a big challenge to get people to trust you when you say social distancing and all that.
In my opinion, misinformation is everywhere. And really, we could all start here and have a discussion, make an argument about what's right, what's wrong. And you could phrase it, a healthy young person, why should they be held, their actions be limited because we're concerned about somebody else? Then comes down to the question, how much is your mother and father worth? How much is your uncle worth? Your grandparents? How much are your children worth? And each one has to make that decision themselves, and not to start another political discussion about who's right, who's wrong, what's information, what's misinformation. What I really would love to see, and everybody's going to have, that's going to play out, and everybody's going to have their own opinion on what's right and what's wrong. What I would like to see is the the health department acting as the inculcator in chief in Cayuga County. When there's a question, when there's a concern, when there's doubts, we could go to the health department and they'll give us facts. What we do with those is up to us. But at least if we could get into a fact-based discussion, that's as much as I would look for.
And I think that Cassie and John are spot on when they're giving you guys great kudos for doing such a great job. It's already happening, Ralph. It's already, the health department is being very factual and very upfront and very straightforward.
Well, what I'm referring to is factual and providing as a source of information for the general public. Doctors and people who are well informed have lots of information out there. But when the general public has these kinds of questions, what do I believe? What kind of test should I take? Who's right? What are these facts? I would hope that anybody in this county could go to the health department and they would be able to at least get the facts.
Yes. And usually, and we do take calls like this all day and all night, frankly. They're calling during the night. I got one at midnight last night. But anyways, the thing that we always come forward with, it's the fact that we have of today. This is a new virus, and we're learning, all of us are learning about this new virus. So there'll be new facts, and persons that we do have on quarantine or isolation, one of our things is we will be talking to you every day to certainly see how you're doing, but also we'll provide you any new information that comes out. What I tell you today may be different on Thursday. So, and I do think they have gained, we're trying to build trust, like you said, and being forward, saying there's new information that's coming all the time.
Maybe even an online tool, something that could be an active document that could be updated as necessary, where just the general public could take a look at that. Oh, I wonder about this or that. And they could just refer to it and at least have someone that is dependable, knowledgeable, and reliable, and an elected government, a government entity representing our elected government that you could go back to and say, okay, these are the facts.
Mm-hmm. Yep.
Agreed. And I think that's happening to a great deal. That's already in place.
All right. Anybody else have anything else for Kathleen or Nancy?
I gotta take off, everybody.
All right. Thank you.
Or anything?
Thank you.
All right. Bye, guys.
Bye-bye.
Bye.
Thank you, Nancy, and thank you, Kathleen. Should we move on to the medical director, Dr. Joya?
Hello. I can be the cynic in chief here. Yeah, unfortunately, a lot of times in epidemiology, everything we look back at, like the SARS, but that's like 15 years ago. We got some facts from that, and they're still arguing about what was going on. And And then we got the things like tuberculosis and syphilis, which we understood pretty well once they were going away. Heart attacks, cardiac disease, we're understanding better, though it's people mostly have figured out there's less of it than there used to be. So I know pretty cynical about standard knowledge and information. We may not have really great facts for a while. I think the main things like doctors in practice got to do is always got to be conservative. You make sure that you take care of the worst possibilities and make sure people know what the risks. It may not be as bad as we think, but it may not be as good as we think either. It's because the knowledge is kind of sparse. So it'd be nice. The main thing, I guess, about the facts is to make sure that people know that there's the misinformation on the internet is not true. But if people are people will just go to their favorite websites or Facebook pages, and that we don't have much control over that. So yeah, I think basically still I'm all for going with plan for the worst, hope for the best. Things definitely we don't want to do is have one sick person that's sociable and going place to place, and even people got masks on. But if you have one person that's really banned to go shopping, or there's somebody that's in the supermarkets who is sick and they're sneezing on their friends and relatives or customers, can't allow that for sure. And then people wearing masks, it's going to help for people who are asymptomatic and they're working. If they cough or sneeze, it will help decrease the risk other people can get it from the asymptomatics. The symptomatic people shouldn't be at work unless it's something really essential and they protect other people and themselves very well. So so you got to be careful, still wearing masks no matter what, barriers, social distancing. But you can do stuff if you're careful and people are self-controlling in terms of spreading mucus and saliva and any body fluid contacts, staying away from that. Sure. And like people are saying on the testing, we have more testing, but one of the things we realize that is the testing is still got a lot of false negatives. And the PCR, which is the best test, and then the antigen testings is even probably worse. But if you do work with what you got available and use it according with what you know the results mean, but not easy.
Okay, anything else for us, Phil?
I think that's enough. Just the basic stuff. Being careful when you're, like you say, when you're driving or you're traveling, or careful if you got bad depression or still overdoses and drugs are still there. That's for sure. So, got everything else in life going on. And, always being frugal when you can be, and get more stress with economic stress too. So, but stick with the basics. Sure.
Okay, well, thank you. So I think that's it for today, unless somebody has something new. If not, I'd be happy to take a motion to adjourn.
I'll motion for an adjournment.
I'll second it. Brian?
Very good. Thank you, Ralph, and thank you, Brian. Very good. Thank you all for participating, and we'll see you next time.
So long,
Bye-bye.
everyone.
Bye-bye.
Bye.